Shays with this week's health and nutrition news. A bionic ear is helping a deaf boy hear his family for the first time as medical technology begins making the impossible possible. Our ears are made up of 3 sections, starting with the sound-collecting outer ear that also includes the ear canal where wax is produced. The middle ear is where sound waves are turned into vibrations that are delivered to the inner ear. And to do this, it uses the eardrum, which has a thin piece of skin stretched tight like a drum. Once the eardrum begins vibrating, it moves 3 tiny bones called the hammer, anvil, and stirrup, which then send sounds to the cochlea. The cochlea is located in the inner ear and is a curly tube that resembles a snail shell. It's filled with liquid and tiny cells that create nerve signals so the brain can understand sound. When someone is born without cochleas, like 5-year-old Caden Morin, a cochlear implant won't help them hear. Fortunately, surgeons were able to fit him with an electronic device called an auditory brainstem implant, stimulating brain cells directly to create a sense of sound. Now he can hear for the first time in his life and is already undergoing speech and hearing therapy to get used to the new sensations.
We were amazed and delighted at how well he responded.
Maybe Caden could use some music therapy now since it's been linked to better post-surgery recovery. A study found that music therapy can reduce the need for relaxing drugs like sedatives. Plus, patients who chilled to the beat of their favorite tunes required less overall pain medication. A music therapy session usually lasts 45 minutes to an hour, and the therapist will play music to soothe patients. Listening to music also increases attention span and boosts mood, while playing instruments sharpens creativity and thinking skills. If dancing is more your thing, moving to the groove can actually improve coordination and build muscle mass. Music therapy has also been shown to be an effective way to prove psychological calm in time of stress. Kissing bugs are swarming the USA with tropical diseases like Chagas, dengue, river blindness, and chikungunya. That's a mouthful. And you definitely don't want to get a mouthful from kissing bugs, who go by the scientific name as triatomines. These little bloodsuckers, along with mosquitoes and other flying vampires, are bringing exotic diseases, even to people who don't travel. Chagas, which infects 8 million people in Latin America, is now spreading throughout the USA, causing symptoms like swelling, fever, and headaches. Sometimes, Chagas can cause heart swelling, leading to heart failure. So, if you see an insect that looks like a harmless beetle, don't go picking it up. It might be a kissing bug, waiting to give you a big old disease-filled smooch. We can't stop all bug bites, but we can make changes to prevent diabetes, a sugar imbalance disease that has grown by 60% in the past decade. About 90% of diabetes cases are type 2, which is linked to bad diet decisions and obesity. See, our bodies need insulin to balance blood sugar levels, and consuming too much sugar can throw our body's natural balance out of whack. If diabetes isn't treated in time with medicine like daily insulin shots, it can lead to nerve and organ damage, or even loss of vision. So lay off the soda and the sweets, and get your weekly exercise fix.
Dips! Hop! 1, 2. Hey, you, get off that couch. Do dips.